So I want to talk about the economic way of thinking during a pandemic. I was an advisor to the U.S. government during the pandemic, along with Michael Creamer and a number of others. And a few things struck me. First of all, in talking with my fellow economists, it was actually quite easy to come to agreement on what should be done, even among economists of widely different political persuasions. But in talking with people in government, I was talking with senators and representatives, not just in the U.S. government, but in the British government, governments around the world. And sometimes, they found the economic way of thinking extremely useful to them. At other times, however, they were baffled by it. And yet other times, they were, 100% sort of opposed to it. So I thought I'd talk a little bit about how some of that came up. And some of the difficulties we had. Now, the first kind of most obvious lesson of the pandemic, of course, was the importance of externalities, okay? So economists understood right away, masks, vaccines, externalities, we got that. But even more fundamentally, okay, there was another issue, which was that during the pandemic, the entire world economy really became dependent on a single sector, on the vaccine sector. So in Michael Creamer's terms, the U.S. economy became an O-ring economy. Everything was dependent upon getting this single sector right. Get the vaccine sector right, and the hotels will come back, the airlines will come back, the restaurants will come back. And yet, it was very obvious, okay, that the vaccine firms, the vaccine sector, could not possibly recoup all of the gains which they were capable of creating. So for economists, it was very clear that it made sense to subsidize the vaccine sector. Now, with Michael Creamer and others, Susan Athey and others, we founded this AHT team, Accelerating Health Technologies team. So what we did is we recommended to the U.S. government two things to do. So we said, first of all, you need to subsidize at-risk capacity, okay? So even before a vaccine is approved, okay, invest in the clinical trials, invest in getting the vaccine companies to build the factories before they even know whether the vaccine is going to be approved. Because then we're going to be ready to go on day one. If one of them is approved, we got the factory already built. That was one point. Second point, we said, look, you got to guarantee them some sales. In past pandemics, they've come and then they disappear, like Zika, okay? So we said you got to guarantee them some sales. So even if COVID goes away, okay, you've got to give them some guaranteed sales. So basically, then we also proposed a portfolio of vaccine candidates, okay? And we explained, look, billions are less than trillions. You would be amazed at how many people really appreciated this very simple insight. Spend billions, save trillions, okay? That really was actually giving them some quantification was actually important. Even that simple quantification. This is the world's easiest cost-benefit test, okay? And just explaining that was actually huge. So these ideas were subsequently adopted by Operation Warp Speed. Now, I don't want to say post hoc ergo propter hoc, but we were pushing in the right direction. Now, compare this economic way of thinking with sort of folk intuition. Because economists, we were worried that the vaccine sector wasn't profitable enough. Meanwhile, the man in the street was worried that it was going to be too profitable. Okay? So you had, will COVID-19 vaccines, medicines serve profits or people? No idea that, hey, these things sometimes might go together, that we might want an incentive to serve people by giving profits. Here was another amazing quote. This was from a activist organization, and they were worried about the massive profiteering opportunities and locking in the advanced market commitment, remember, they were worried about locking in a $20 per dose cost. Now, this is a time when we were calculating that the value of a course of vaccines
was worth over $5,000 to the world economy. So a luck of $20, was unbelievable, right? But that's what they were worried about. And then this went all the way to the top, okay? So the American people should never be left doubting if the government will put public health over profits during a pandemic. The very first person to be fired should be Moncef Slaoui. This is Senator Elizabeth Warren. Moncef Slaoui, if you don't know, was the civilian head of Operation Warp Speed, one of the most talented vaccine designers in the entire world, and he had come out of private practice to lead Operation Warp Speed. This, to me, just infuriates me to this very day. It's one of the worst statements of public policy ever made. And this was not without consequence. This fear of profiteering was not without consequence. So Australia, for example, they dickered over the vaccine prices, okay? And the result was a delay in vaccine purchases that slowed economic recovery and created billions of dollars in losses, far in excess of any potential cost savings. Here was another way in which the economics or mathematical way of thinking, came across, I think, a problem we all have, which is, thinking in terms of exponentials, right? So think about what was going on, right? So this is January 7th, 2020. China reports a new coronavirus, okay? January 13th, you had like 44 confirmed cases, 1 death. January 20th, a week later, you got 80 confirmed cases, 2 deaths. January 27th, okay, 1,000 confirmed cases and 53 deaths. Now, it actually wasn't crazy in a sense to look at this and say, well, why are we worried about this? Why are you worried? Because auto deaths in China were like 1,000 per week. Cancer deaths in China were like 7,000 deaths per day. So you might look at this and wonder, well, why should we worry? Okay. And yet, at the very same time, Richard Hatchett, who was the CEO of CEPI, the Center for Epidemic Preparedness. This is the most important organization you may never have heard of. CEPI was by far the first on the ball. They were the first to understand how important this coronavirus could be. So Richard Hatchett, the CEO, on January 28th, he was calling up world leaders and going crazy and saying, look, there could be tens of millions of deaths. And he was putting his money where his mouth was. So even before that, on January 20th, he had put $1 million into Moderna and said, listen, start making the vaccine. January 20th, start making the vaccine. Okay? Why? Well, because Hatchett understood exponential growth, right? There's the famous chess example. You have the one grain on the first, and then 2 on the second, and 4 on the third, and so forth. And by the time you get to the end, is more grains than all of the harvests in the entire world. Okay? But explaining the reality of exponential growth is very, very difficult, right? Because if you're not too early, you're too late. And for politicians to act early before any problem is really obvious. It's a very difficult problem. It's a very difficult problem. There was also a difference between the economic way of thinking, how economists were thinking about things, and how physicians were thinking about things. Physicians look for rules which maximize the health of the treated. Economists, however, are sort of natural utilitarians, right? They look for rules that maximize the health of society. No, ordinarily, these two things are in perfect coherence. But during the pandemic, there was a split. So the utilitarian approach led economists to appreciate things like the benefit of dose stretching policies, like first doses first, which is getting everybody a first dose before you gave a second dose. I was a big proponent of this. Great Britain, Canada did it. The latest estimates, 10,000 lives saved in Great Britain by doing first doses first. We probably should have done it in the United States. But physicians were much more focused on, no, we have to treat people. Okay, you have to maximize the health of the treated, while economists were thinking about maximizing the health of society. The value of testing the asymptomatic. So Paul Romer was a big proponent of this, and early on had done a number of simulations showing that if there's a lot of people who are spreading this disease who don't have symptoms, you want to test them. You want to test them to reduce the transmission. Okay? Well, again, physicians were thinking about testing as a diagnostic. We want to test so that we know how to treat. If somebody doesn't have symptoms, we don't have to treat them, therefore we don't have to test them. And that created problems. Human challenge trials. Human challenge trials, right? Was a big, big difference between economists and, not all physicians, but many physicians. I want to say actually a little bit more about this. Why were there no human challenge trials till very late? Just think about the importance of this. So January 11th was when the genetic code of SARS-CoV-2 was uploaded from Yang Zhang's lab to the internet. Within 2 days, a vaccine had been designed. So we had a vaccine designed within 2 days of knowing the genetic code. Everything else was testing. And we went for big randomized controlled trials. And the problem with big randomized controlled trials is what you do, you take 30,000 people and 15,000 of them you give the vaccine and 15,000 of them you give a placebo. And then you say, just go off, live your normal lives. And then you wait. And you wait. And you wait until enough of them have gotten COVID that you can unblind the trial and see whether there were more people in the placebo group relative to the treatment group who got COVID. It takes time. In a human challenge trial, you take 100 volunteers, 50 of them you give the vaccine, 50 of them you give the placebo, and you expose all of them to the virus. You have your results within a week. Now, the National Institute of Allergy and Infectious Diseases under Dr. Fauci said, we're not going to do human challenge trials. We have no plans for this. So Dr. Fauci's office said the Institute had no plans to fund COVID-19 human challenge trials in the future. Many bioethicists support that decision. We don't ask people to sacrifice themselves for the good of society, said Jeffrey Kahn, director of the Johns Hopkins Berman Institute of Bioethics. What? We don't ask people to sacrifice themselves for the good of society? We ask them all the time to do that. We ask people, the police officers, we ask people in the military, we ask coal miners to do this, right? What is he talking about, right? Some person possibly related to me, okay? We don't ask people, bioethicists, we don't ask people to sacrifice themselves for the good of society. At the same time, please wear a mask and stay home for the good of society. That's what we were asking people to do all the time. So what's he talking about? What on earth is he talking about? Well, I think what he's talking about is actually the omission-commission asymmetry. Okay? Why were physicians worried about human challenge trials? Well, the first thing they would tell you, it'll be bad. It'll be terrible if some participants die. Which of course it would, but in a randomized controlled trial, people also die. People did. People did. So people in the control arm, in the placebo group, they died. Maybe even more of them than would die or possibly get sick than in a human challenge trial. Not to mention the fact that, of course, the human challenge trial gives you results much, much faster. Okay? Well, why? Why did they treat these things so differently? Well, in an RCT, you can say, well, that wasn't me which caused these people to get sick. That was, nature, that was bad luck. They were just living their ordinary lives. I didn't do it. In a human challenge trial, you did it. You exposed them to the virus and they got sick, right? In a human challenge trial, people were worried it's going to be our fault. We're going to feel bad. Okay? I get it. Physicians would feel bad if they ran a human challenge trial and somebody died. Somebody got sick. The physicians are going to feel bad. But my answer to that is, it's not about you. It's not about your feelings. Take yourself out of the equation because it's not about you. Do the thing which maximizes expected value. In my view, not doing the human challenge trial was the selfish thing to do. because it meant you didn't have to worry, physicians didn't have to worry about hurting their feelings, but we didn't do the thing which would have saved the most lives. Utilitarianism says there's no role for the emotions of the decision maker per se, right? Just maximize social welfare. It's not about you. This was another thing which I heard many times, right? Economists who were talking about COVID policy, they were accused of being both arrogant and ignorant, okay? And not staying in their lane. Not staying in their lane. So Emily Oster, for example, was accused of, quote, being an irresponsible child and teacher killer. Why? Because she was discussing the trade-offs of school closure and the value of lockdowns. This was one person on the internet said, "You are not a medical doctor, a public health expert, an epidemiologist, a virologist, or a public health official. What you are saying here is misleading and dangerous, dangerous." And, I blocked this person out, but they were a cartoonist. Okay, this is a cartoonist. Okay. All right. Well, let's think about this, okay? Oster was violating taboo trade-offs, right? Let's think about this. What is the most important graph in economics? What's the most important graph in economics? Supply and demand. What's the second most important graph? Thank you. Exactly right. Exactly right. Okay? PPF, guns and butter, right? Guns and butter. So imagine going to economists and saying, "You're not a military expert. You're not a dairy farmer. How dare you talk about the trade-off between guns and butter? You have no expertise in the military or in cow udders, right? And yet, you cannot leave the choice of how many guns to have to the gun makers or how much butter to churn to the dairy farmers. The gun makers don't know about the dairy farmers, and the dairy farmers don't know about the gun makers. You cannot leave that choice to them. We have to evaluate trade-offs. Society must evaluate trade-offs. There is no choice about that, okay? Now, economists, I'm not saying this is easy. Economists, when they're talking about trade-offs, bear some responsibility. They must know something about guns, and they indeed must know something about butter, and then they must be neutral in evaluating the trade-off. This is not easy, but it is necessary. So the economist's lane is evaluating trade-offs. That is what we do. That is our lane. So Emily Oster was doing exactly the right thing, which a good economist should do, which is bringing to bear all of her knowledge and wisdom about both health policy and school policy to think about these trade-offs, because there is no avoiding difficult trade-offs. One way or the other, those choices are going to be made, and it is much better if we have someone thinking about those choices, and that is the economist's lane. In terms of economics education, I think there's actually a tremendous amount of things that one can do around pandemic policy to introduce, a deep classroom discussion and vivid classroom discussions, right? So you can talk about, were the profits in the vaccine industry, were they too high or were they too low? Think about the economic way of thinking and the political way of thinking. Should medical care aim to maximize the health of patients or the health of society? When are these going to differ? Is it ever acceptable to trade off lives for goods and services? That's a fun one. Okay. What is the value of the human life? How do we quantify it? Do the risks of human challenge trials differ from randomized controlled trials? The difficulties of understanding exponential growth. And what is the role of the economist in society? Lots of material for discussion here. So the economic way of thinking in a pandemic, externalities, quantification, understanding exponentials, utilitarianism. I've only actually told you half the story. My co-author, Tyler Cowan, during the pandemic, created FAST grants. So he raised over $60 million of private money and was funding clinical trials and scientific research into COVID long before the NIH got a single grant out. NIH is great, did a lot of great things, but they were not fast. They were not fast. Fast grants was fast. Fast grants funded the spit test, okay, which many of you ended up using, which the NBA ended up using. Would not have happened without Tyler Cowen and fast grants. And this is entirely independent of my work. And so it's a little bit peculiar, actually, how we both came to play a role in the pandemic. And I think a necessary condition, but not a sufficient condition, but a necessary condition was we'd both been thinking about pandemics for a very long time. So in the very first edition of Modern Principles of Economics, we talked about pandemics, both in micro and in macro. So in macro, we talked about pandemics as a potential real supply shock, like generating a real business cycle. What would that do? Okay. In microeconomics, we talked about externalities. Our go-to example for an externality is a flu shot. We talked about, again, in the very first edition, we talked about how you might want to keep a vaccine factory in your country with trade policy. You might be a little bit worried if they all go abroad. Okay, maybe this is something to think about. And yeah, in the macroeconomics of real shocks. So it was all there in the first edition. So students who used Modern Principles of Economics were well prepared. Thank you very much.